Hey, it's Dr. Karen with this week's Hot Topic. Make sure you like this video, follow us on social media, and subscribe to our YouTube channel so you never miss another hot topic. So today I want to talk to you about shin splints. So this is pretty typical, and this applies to most of you who are those weekend warriors that you'll hear my emails about or we talk about a lot in these videos, that weekend warriors are really prone to a lot of things. So you might also hear it called like a medial tibial stress syndrome. It's typically a shin splint, but it is caused by stress in your shin bone and that connective tissue that attaches the muscles to your bone. So it's kind of right, it's your shin bone. So it does get inflamed. It can get super painful. So it's really common and can result from just a couple things. So if you have some of these things, these are more like risk factors. So flat feet. So this is when the impact of the step makes your foot's arch. There's a couple arches in your foot, but it can actually collapse it. So this is more overpronation. So your foot tends to turn a little bit this way. Shoes that don't fit properly or give you good support. Working out without warming up or cooling down stretches. So those also can be some risk factors. You can have weak ankles, hips, or core muscles. If you're a runner, especially beginning a running program, or you suddenly increase the duration, frequency, or intensity of exercise, or again, doing things on the weekend because you have to get a project done and you don't have all this time. Running on uneven terrain. So now that the weather's getting a little bit warmer, people are tending to go outside. So you're running on hills or hard surfaces like concrete, those type of things. So what does it actually feel like? So if you've never had shin splints, you might notice that tenderness, soreness, or pain along the inner side of your shin. You could also have a little bit of swelling in your lower leg. That is typically common with a shin splint. So at first you might notice this pain, it stops when you're exercising, but then eventually this pain is just going to be continuous, and it might progress to a worst case scenario. It's going to potentially give you a stress fracture, or you have that stress reaction along your body, which I've talked about what stress does to your body a lot. So that's basically a shin splint. They're really uncomfortable. You don't want them. So how do you treat them? So typically they can heal on their own. But if you do come and see a doctor, so whether that's your GP, whether it's us, your physical therapist, somebody will do an exam on you. So most of the time what we'll find, again, we're going to try and rule out to see if there is a stress fracture. But really the big one is just resting your body. Your body needs time to heal. So you want to avoid overdoing too much. So no running or other high impact activity for too long. So it can actually cause that too much overload on your shins. And so that's the intensity that you're going to get. Icing your shin to ease the pain and swelling is going to be really good. So for 20 minutes every couple hours, so you can do this for 2 to 3 days, or 2 to 3 times a day until the pain is gone. Ice cups work really well for that. So just do it until the ice melts. That's how you know you've done it long enough. You can use insoles or orthotics for your shoes. So those shoes inserts, they can either be custom made or you can buy them off the shelf. Like I prefer Super Feet if you're going to buy non-custom ones. So these can help support your fallen arches in your feet. So when you stand up, it's going to give you a little bit more support. Another option you can do is if you do need like an anti-inflammatory painkiller, so you can take some NSAIDs, which are over-the-counter non-steroidal anti-inflammatory medications. So like ibuprofen, naproxen, those type of things are going to help with that pain and swelling. But again, you don't want to mask them. So you want to make sure you're actually addressing all these things. So you do want to make sure you're not taking these over a long period of time, because you can have a greater chance of bleeding, ulcers, all those other things that may come into place when you take all those NSAIDs. And really the big one, of course, as a chiropractor, I'm going to tell you to get your feet adjusted. So we've already talked about it. It can be from those fallen arches, and it's just part of that kinetic chain. So if your feet are constantly hitting the ground, it's going to cause that anterior tibialis to be a little weak. We can adjust your ankle and make it feel so much better. And then the last little trick that you can do, which sounds super simple and kind of weird, but it's just walk backwards and be a little exaggerated about how you walk. So that's going to help kind of stretch out those muscles, and it just works things a little bit differently when you're walking backwards. So that's actually one of the best things that you can do if you find you have shin splints. And if you don't know you have shin splints, chances are you probably don't don't have them. Shin splints are really uncomfortable. It's like this burning sensation in front. You can also tape. That's another thing that you can do too. But so if you have shin splints, know that you can have some relief from it. You know, ice cups are probably my favorite, and of course getting your feet adjusted. Those are probably my best options. If you came into us and you said, oh, hey, I have shin splints, we can fix you. And we can help you, but that's probably what I would recommend. So that's all I have for you guys this week. I will see you guys next time.